Hello and welcome. Today I'll be reading an article entitled Oxidative Stress and Cocaine Intoxication as Start Points in the Pathology of Cocaine-Induced Cardiotoxicity. This is being accessed on NDPI. You can read the full article. It's open access. It's from journal Toxics in a special issue, Poisoning Caused by Medicines and Drugs of Abuse. This is from 2021. I'll be reading the abstract and the introduction. Abstract. Psychomotor stimulants are the most commonly used prohibited substances after cannabis. Globally, their use reaches epidemiological proportions and is one of the most common causes of death in many countries. The use of illicit drugs has negative effects on the cardiovascular system and is one of the causes of serious cardiovascular pathologies, ranging from abnormal heart rhythms to heart attacks and sudden cardiac death. The reactive oxygen species generation, toxic metabolites formation, and oxidative stress play a significant role in cocaine-induced cardiotoxicity. The aim of the present review is to assess acute and chronic cocaine toxicity by focusing on the published literature regarding oxidative stress levels. Hypothetically, this study can serve as a basis for developing a rapid and effective method for determining oxidative stress levels by monitoring changes in the redox status of patients with cocaine intoxication. Introduction. Cocaine, together with amphetamine and its analogs, belong to the group of psychomotor stimulants with different pharmacological and pathophysiological properties and with a well-described synergy between them. The effect of various drugs on dopamine regulation and the role of the dopamine molecule in the development of drug dependence and addiction has been well studied. As a central nervous system stimulant, cocaine causes a feeling of euphoria, increased motor activity, and reduced feeling of fatigue and hunger. In response, it leads to addiction and dependence, leading to chronic use, and increases the risk of damage to the whole organism. In addition to its effects on the CNS, its use can lead to significant cardiovascular complications and sudden cardiac death. Sudden cardiac death is characterized as a dynamic event and represents the sudden and unexpected death of cardiac etiology. It is defined as a sudden, unexpected, pulseless condition, which usually occurs within less than 1 hour of the onset of symptoms and is often due to cardiac arrhythmia. Depending on the dose and the presence of concomitant cardiovascular disease, the clinical effects vary widely and include vasoconstriction, arrhythmia, tachycardia, aortic dissection, heart attack, myocardial ischemia, etc. Not only are the harmful effects of cocaine well known, but also those of its metabolites, which can cause serious and irreversible damage to the entire cardiovascular system. Cocaine exerts its toxicity on the human body by generating reactive oxygen species, ROS, such as hydrogen peroxide, hydroperoxides, alkyl peroxide, superoxide, hydroxyl, and others. According to the data, ROS production and oxidative damage are considered significant factors in cocaine-induced cardiotoxicity and the pathogenesis of cardiovascular disease. In this review, we examined the detrimental effect of cocaine and its metabolites on the cardiovascular system. Moreover, we accented to the role of oxidative stress in the pathology of cocaine-induced cardiotoxicity. The review aims to develop methods for diagnosing acute and chronic cocaine toxicity by determining oxidative stress levels in biological samples used mainly in emergency medicine and toxicology clinics. So, just to pique your interest there, I hope you go and read the full article. You can access it at the link that I post in the description below. As always, nothing that's discussed on this channel can be used as medical advice. Always discuss with your primary care physician. Hope you enjoy the video. Dr. Weber out.